Hi guys, welcome back. I'm sorry it has to take me some days to get back to us. Sorry, I was a little busy. So today we'll be talking about how you expect your uterus or your abdomen to grow if you are pregnant. This will give you a guide to know whether your baby is growing well or not growing well, whether your baby is growing smaller than the gestational age or whether your baby is growing bigger than the gestational age. So it will give you a clue on when to seek medical attention. Don't forget that pregnancy is a very beautiful journey. And for us obstetricians, we like you being pregnant because it keeps us in business. Anyway, that's by the way. So it's a beautiful journey, bringing out a life into this earth. And we don't expect any woman to die while giving life. So for that reason, I'll be telling us on what to expect and how you expect your uterus to grow when you are pregnant. When someone misses her period, we'll call it the last normal menstrual period. When you come to the hospital, we'll calculate retrospectively from the time you saw your period last. And actually, what we'll ask is the first day of the beginning of the last normal menstrual period. It gives us a clue to calculate what's your gestational age. Gestational age is the weeks, how old your pregnancy is. So when you tell us the last normal menstrual period, it gives us a clue on how to calculate your gestational age. And for most times, some women don't know when they miss their period. So we encourage that for every woman, whenever you see your period, you should get a calendar. Go to that calendar for that month, circle the beginning of that period. That is what you're going to tell your doctor when you go to register for that antenatal clinic. The beginning of the last normal menstrual period, the one you see, not the one you did not see. So from there, we'll be able to calculate what your gestational age, that is how old your pregnancy is. And it will also help us to know when you are expecting to deliver rather. We'll call it expected date of delivery. This is an estimated date, not actually the actual date. It may be the real date, it may be plus or minus 2 weeks in addition. So that's about the introduction. My name is Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazion. I discuss everything about women's health, children's health, and sometimes men's health. If you are new to my channel, please, and if this interests you, subscribe to my page right now. Hit the notification button for more video. I have other videos already uploaded. You can go on to check. So let's go on. When a woman is pregnant newly, she may not know until she misses her first period. And sometimes we advise that you wait until after 10 days after you have missed that period and you have not seen it. Now you can go on to do a pregnancy test. That pregnancy test will give you a clue. Okay, you are pregnant, and if you calculate it retrospectively, you will get the estimated fetal weight. So concerning your abdominal growth, that is your uterine growth, nothing may be seen on physical examination. You may not see anything, but if you do an ultrasound, you may see a bulky uterus. So let's go to the physical examination. Nothing, you will not feel anything on your abdomen will not grow. People will not even know you are pregnant until about 12 weeks. At 12 weeks, you will see, if you palpate, you may feel the uterus on the pelvis. That is just that's pubic bone, the bone on your close to your vagina. So that first bone you palpate, you may see it. If you put your hand inside, you may feel your uterus there. Your uterus has started growing. So after 12 weeks, between 12 weeks, 12 weeks is actually 3 months. Between 12 weeks and 18 weeks, you will feel your abdomen. By then it has started growing. You will feel your uterus if you do palpation between the lower aspect of your umbilicus and that pubic bone. So it is at the middle. That means that pregnancy is between 14 weeks and 16 weeks. When you are 18 weeks is around 4 months, your pregnancy will be feeling the upper part of your uterus, that is your womb, on the lower aspect of your umbilicus. Lower border, this is the umbilicus. You'll be feeling it around here. Now, if you are 20 weeks, you start feeling it exactly on your umbilicus. If you are 22 weeks, you start feeling it on the upper border of your umbilicus. So your uterus will continue to grow. 4-finger breadth above your navel, that's the umbilicus, shows that you are 28 weeks. So if you do 4-finger breadth above your navel, you will see the uterus when you have entered 7 months. It shows your baby is growing fine. Now, as the baby continues to grow, another 4-finger breadth from that first 4-finger breadth will show that your baby is about 34 to 36 weeks, means it has entered 9 months. At 36 weeks, you have entered your 9 months. When you start feeling your uterus here, it means you're already 9 months and you are waiting for delivery. So that is how your uterus is supposed to grow. When you have entered 9 months, sometimes a woman will feel what we call lightning. The head will descend into the pelvis, and the level of the stage at which the upper border of your uterus is on the abdomen will come down. It shows lightning. The baby is trying to descend and for labor to start. Now, there are exceptions to this. If a woman is carrying twin, your uterus will grow faster than it's supposed to be. At 8 weeks, your doctor may not be able to palpate anything when he or she does abdominal examination. However, when you are carrying twins, at 8 weeks, you might start palpating your uterus on the abdomen. And so at that time, the doctor will be worried, why is this uterus here? It's growing more than normal. So you go and do an ultrasound, and ultrasound will now show that you're carrying that twins or triplets. Now, the uterus will grow bigger than it's supposed to be if you are carrying twins. Now, if you have tumors like fibroid with babies inside, the uterus will grow bigger than they are supposed to be. That's another thing. Then if you have some abnormalities in a baby that will cause the liquor to be big, we'll call it polyhydramnios, your uterus will be bigger than expected. Now, sometimes if you have a bigger baby, we call it macrosomic babies that are bigger than the average babies, you have your uterus bigger. Someone that has gestational diabetes may have a baby that is bigger, or diabetes mellitus in pregnancy may have a bigger baby. So in that woman, you see that the baby is bigger than the uterus. So those are the things. These are things that can make the baby, your uterus, bigger than the age they are supposed to be. Other things that will make the baby smaller than it's supposed to be is that, number one, if you have had what we call missed abortion. Missed abortion means that the baby died before age of viability and there is no bleeding. So the baby is not growing. Uterus is not growing. But you think your pregnancy is still going on. So that can lead to reduced abdominal length when you are pregnant. The second thing is if you have what we call oligohydramnios. Oligohydramnios means that the fluid where the baby is swimming inside your uterus is very small. So because the fluid also is part of the things that is measured with the uterus. So the fluid is so small, and if you now measure your uterus, the uterine size will be smaller than the gestational age. It follows some abnormalities. It follows the woman that has ruptured her membrane. The baby's water has passed. So most times, even if you come in labor and you have ruptured your membrane, you have drained lipo, the uterus will be smaller. So it's also part of it. Another thing that will make your uterus to be smaller is if you have small for gestational age babies. There are babies that are constitutionally small. Maybe their parents are small, so they will be small too. There are also babies that are, babies that have abnormalities, maybe from hypertension. If you have chronic hypertension, or someone that has diabetes mellitus, can have small for gestational age babies. Then also someone that is also in labor already, the uterus, because the head has entered into the pelvis, it's about to come out, so the uterus will be smaller than the gestational age. These and others are among the things that will make your uterus to be smaller than gestational age. So with this point, it will help you to know when your uterus is growing well, when your uterus is not growing well, what you are supposed to do if your uterus, when you are supposed to raise alarm, when you are not supposed to raise alarm. However, if your uterus is growing well, your baby is active, is moving well, I don't think you have any cause for alarm. Thank you for watching to this point. My name is Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazion. Subscribe to my YouTube page at Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazion. Follow me on Facebook at OBGYN Talks with Dr. Adazion. Also on TikTok and on Instagram with the same name, OBGYN Talks with Dr. Adazion. I'm a consultant obstetrician gynecologist. I also offer online consultations. Thank you for watching. Stay tuned for another enriching, beautiful video. See you next time. Love you guys.